What's up, everybody? First, stay there, Adrian. Stay there, everybody. What's up? This is Real Talk Chronicles. I'm your host, Bill Foster, with my co-host, Marilyn Corder, my cousin. But I got the pleasure to see my other cousin right now, her daughter, that's in town. You can throw
in the country.
in the country. Throw your Delta stuff up. Represent your Delta. Yeah, exactly. He's a Delta for all the Deltas that watch us. This is Real Talk Chronicles. We're going to have to do a show on traveling because I know Adrian is loving life. You are all over the place. Everybody, I got to give my cousin her props right now.
Thanks,
listen, I follow her, and let me tell you something. And your narration of what you're doing and the fish and this and the haircuts and all the whole kit and caboodle. Let me tell you something. You need your own little show too. We're gonna have a little Real Talk travel, Real Talk Chronicles travel show.
Yes.
You know? How you feeling? How you doing?
I'm good, man. I'm visiting home. Everybody's here, so I said, let me go back home for a couple of weeks, take care of some business. But I can't wait to get out of here and back to my new hometown.
Good. We can't wait to leave.
Of Ghana.
You're not feeling the United States anymore.
I feel dangerous. It's dangerous here. Like I feel like walking around like this all the time. Like I don't know.
Yeah, it's a little rough.
Yeah, you know what you need, because maybe Wednesday, if you're free, you need to come on the show, because we still talk about a lot of the police and the politics stuff. So if you got some time, you could chop it in, because Marilyn, she got a little chance to get in with Kevin and I, you know what I'm saying? Because I always tell everybody, this is my cousin. So as worldly as she is, she's still family. So, you know, this family right here from that Foster side, but you know, the McPherson side, or whoever side you want to come at us from, we ready for you.
We ready.
You know what I'm saying?
We always been ready.
We ready for that action. So, you know,
I'll be on Wednesday. That's what's up. Just hit me offline and I do it. You know me.
Absolutely. Because right now, just while you're here, because we just want to let everybody know, because of Breast Cancer Awareness Month, we're going to give a little, you know, segment to this show to that. And of course, we're going to let the doctor rock. But first and foremost, Doc, how are you feeling? You good?
I'm doing well. You know, I'm grateful for every day that I'm alive and can begin to continue to help the village. So I'm grateful. And that's the word for the day. Gratefulness.
Got it. And that's a beautiful thing. You know, everybody out here, let's understand something, that the one thing with Real Talk Chronicles, what we try to do, we try to give you positivity and awareness on what's happening in the world today. Listen, authenticity right here. You know what I'm saying? The doc, that's because this is homegrown. This is what we do, you know, from everybody that comes on this show. Listen, excuse me, for those that know, today, Kevin and I was having a little spat offline about something, and we're going to talk about it Wednesday. I don't want to tell you all because we want you to watch, but for those that are watching on social media, on Facebook, share it. So if you're watching on YouTube, subscribe to it. So, Doc, this is Breast Cancer Awareness Month. It is such a topic that all women, Malika will be joining us very soon. She's taking care of some other stuff. We just came off the highway. We have so much to talk about.
Yeah.
Shout out to people that's chiming in right now. Appreciate you. Tramel, we got to get you back on the show. I see you, brother. You got to let us know what's going on. Maybe in a couple of weeks, Tramel, I want to get you back on and we can talk about it. Stefania, how are you? So, because it's like prostate cancer, breast cancer, you know, cancer in general, cancer is a monster.
You know, I'm gonna get started by first saying, first of all, this is October Breast Cancer Awareness Month. However, every day, those who have a diagnosis, those who are living with breast cancer, who are survivors or have lost loved ones to breast cancer, every day is awareness. And one thing I have to say to those out there in the village, being still on the front lines for medicine over the past 42 years, these last 18 months has been hell. And when I say hell, it has really taken the medical community for a total upside down. And there's lots of collateral damage and death in that. When you see what COVID has done to medicine, to the medical arena, to the frontliners who are sad and depressed, etc. They're getting burned out. But the beds in the rooms and the and the vents, ICU, and even the surgery that's necessary, or even what we call elective, have been pushed back months and months. We have now individuals who.
I lost you. I lost you, cuz. Okay,
Okay.
got you back. Got you back.
The diagnosis of breast cancer has been delayed because they couldn't get in to see their doctor, to get the biopsy.
Everybody, we're having a Real Talk Chronicles moment. We have Dr. Marilyn Corder, and we're going to talk about breast cancer. We're going to talk about COVID. We're going to talk about a bunch of stuff as long as we have her with us tonight.
Okay.
And we got you back. Go ahead.
Sorry.
Breast
Sometimes
cancer,
the reception. But
all good.
So we see a delay now, and unfortunately, the disproportionate gaps of breast cancer diagnosis in Black and brown women is even increasing. So we're seeing increase in deaths, increase in the lateness of the diagnosis. So our women, our sisters, our daughters, our mothers are being diagnosed later and later. And this is something we thought we would not see, because we had made some progress in our breast cancer awareness, with our PSAs, with all of that. And, now we're seeing it, and as we spoke to the oncologists, and we spoke to the primary care docs, as well as even the survivors, they're seeing folks who, by the time they were diagnosed, is stage 3 and stage 4, which takes a lot of aggression on your body, and sometimes the lifespan is much shorter. So today is Columbus Day, so they say, and he didn't discover anything as far as I know and see, but I do want to make sure that you guys discover your own health. Make sure you take this day, not just a day off, but to reflect. And this is what our challenge was, to reflect and understand your body, because cancer is everywhere. Breast cancer we see also 5% or so of men. So we need to make, so we have to understand. And if it's in your family, now here's what I want to say, and I may say this 3 or 4 times this evening. You need to know what's in your body, what's in your DNA, what's in your family history, your family tree. In order to know that, we have to talk, we have to communicate, we have to share. Something about having a diagnosis of cancer in our community has been a taboo. Don't say anything, don't tell anybody, and unfortunately, that's a disservice you're doing to generations and generations to come, because we know genetics is strong, and we know if you have cancer, whatever cancer, we're talking breast cancer right now, but you need to share that information, not take it to your grave, not be secretive. The women in your family, as well as in even the men, then they can get the mammograms that ordinarily the insurance may not pay until they're 50 or 45. But people die from breast cancer in their 30s. So if you have someone in your generation, a generation above you, your parents, aunts, uncles, etc., who have breast cancer, you're entitled to get a mammogram, and a specialized mammogram, which is the ultrasound and sonogram, in your 30s, because you may not even see 40s. And the protocol is not to get a mammogram until you're 45 or 50. So as I said, today is Columbus Day. Discover you and make sure you understand. If you see a lump that's not supposed to be there, or know how to do a breast exam. And that's important.
Righteous. And with that being said, I just want to tell everybody out here, this is Real Talk Chronicles. That's my co-host, Dr. Marilyn Corder. That's my cousin, my first cousin. And I'm your host, Bill Foster. And right now, because of breast cancer, we want to have a discussion about that. But what's so funny? Maybe in the near future, we're going to talk more about cancer, because the one thing that Marilyn, now I'm going to call her Marilyn.
Yeah, sure.
Our grandmother. No, I'm going to call you Marilyn now because I'm talking about our grandmother. Our grandmother passed away with cancer.
Right? Yes, she did.
My father passed away with cancer. Our uncle
that's right,
passed away with cancer. Your mother didn't, which was great. But cancer runs in our family, but it wasn't breast cancer. It was prostate cancer and stuff like that. But that's why we're going to talk about breast cancer, and we're going to have the doc break down the different forms or maybe the tests that you need to do. She just kind of elaborated real quick about that, but maybe we're going to slow it down for the people to really catch on. But the one thing, let me ask you a question, Doc. in essence, how many forms of cancer are there?
Well, you know what? Let me just say, in every part of your body, you can have cancer, from a brain tumor with cancer all the way down to cancer of your extremities and skin cancer, etc. You know, it's funny you should say that, because we, even with the research that's going on with cancer, you know, there's something called anaplastic cells, what we call precancerous cells. And I'm going to say this: inflammation in and of itself begins to aggravate and wreak havoc on your normal cells. So there you'll begin to see cancer cells beginning to pop up in different parts of your body. As we know, and as you hear, we all have cancer going on in our body. It's just how much it can overwhelm your good cells. So this is why I tell folks, you know, inflammation, depending on liver, there's something called fatty liver. A lot of people have that and don't know it. It ends up turning into cancer of the liver, not cirrhosis. Cirrhosis we talk about with alcoholics, but cancer of the liver, cancer of the prostate, cancer, and it's inflammation. That's a big word. So you need to de-inflame your body by eating better, by getting your rest, by understanding what is happening to your body. Do you know the latest studies in the past 3 years? What year is this? 2021. I guess about 3 or 4 years ago, they related cancer, the cancer specialist, to obesity.
Really?
To obesity. In other words, being fat increases your chance of getting cancer, because when you are obese, your body is inflamed, your body is stressed. That's the word we can say use. Your body is stressed, thereby aggravating different parts of your body, especially your abdominal organs, which are your kidneys, which is your liver, which are your pancreas, you know, and your colon. And colon is what, you know, I tell folks that's the waste product of what you're eating. And, you know, we say you are what you eat, but what you eat can kill you. I add that part. We are what we eat, but what you eat can kill you, especially red meat. And again, as I used to, years and years of studying at Howard in medical school, the one thing we saw here in the United States, we have the number one rate of colon cancer. And that's because we eat junk, we eat red meat. And what you eat, again, is who you are and what happens. So there are tons of different cancers. And then you could talk about stages, and you could talk about types of cancer. I don't want to break it down to it being a medical lecture, but what I do want to do is make sure that
It's your show.
right.
It's your show.
Okay.
It's your
And
show.
and only because I want to keep it basic,
Right,
but
right,
in
right.
keeping it basic, it starts with knowing your body.
Got you.
And
Got
keeping it basic is starts with not being fearful when you feel a lump, when you see what we call a deformity appearance, when you look at yourself in the mirror, you got to see your body. And we're talking breast cancer. So if all of a sudden something looks a little different, a little dimpled, a little red, you know, there's even a type of cancer that we relate to an orange peel. Think of an orange peel. It has little dots and dimples, and it may be even a little rough. When you feel that, even if it's not a lump, that's important to.
Hold on. We lost you for a sec, Doc. Everybody, this is Real Talk Chronicles. That's Marilyn Corder. I'm Bill Foster. And we're talking about cancer right now, but, you know, we want to do this about breast cancer. We also want to talk about, we're going to, you know, end out with COVID. Doctor's going to give us some knowledge on that. So, Doc, let's take us through the steps right now. Shout out to everybody that's watching. I'll read the comments in a minute. I just want to let the doc finish on what she's saying.
And I'm sorry, because sometimes I'm getting calls from my patients, so I'll
listen,
text them back.
That's all right. And we love the patients. So, Doc, what I want you to do for the women that are naive, and I use the word naive because a lot of times we don't want to know about what's happening with our bodies, right? Let me just say this. We just got a call before we came live. We have one friend that she found out, she's not a friend, a friend of a friend, that she has, is it bladder cancer, or something like that. And then we have another friend that right now he's in the hospital with blood clots on his lungs. So the devil, like we said, the devil is working hard out here. And then we have COVID and so many other things. So right now, we have so much, and that's why your shows are so paramount. Walk a woman or a man, because like you said, 5% can happen to men. Walk them through the first stages of how they find out that they might have breast cancer. Go ahead, Doc.
Well, first of all, you'd be surprised how many people are their own discoverers in terms of finding a breast lump or finding a lump, finding something different. And we try to teach and we encourage, even as young as 16, 17 years old, a breast exam. We do it, of course, in the office, but you usually would be the person that detects the breast lump, the breast abnormality, you as yourself. And we tell folks, make sure you know how to do a breast exam, either as you're in the shower or, if you're laying down. It should not be at the time of your cycle, because often menstrual cycles can give you fibrocystic or tenderness in your breast. And those are what we call benign cysts. But you want to have that exam not at the time of your cycle, but once a month at least. And you want to know your breasts. You have to know your breasts. And when you're in the doctor's office, if you have no idea or don't have a confidence on how to do a breast exam, please make sure you take that opportunity to have your doctor show you how to do an adequate breast exam. I must say that your breast tissues begin in your axillary, in your armpit. So make sure you start up in the armpit, because that's where the breast tissue begins. And sometimes that's missed. And we do a circular, I tell folks as I'm doing the exam and teaching them, you do a circular motion and you cover the entire surface. It's almost like, like cutting grass. You go around, you go around, you go around all the way till you're at the point. You overlap and you make sure you understand what normal tissue feels like. And if you begin to feel the lump, it could be the size of a peanut. It could be the size of a grape. It could be hard. It could be soft like a cyst. But it's very, very, very important to understand what normal breast tissue feels like. It's important to understand when it is tender or not tender. Either way, please, please make sure you get it checked. Now, I will say this. COVID has stressed a lot of the primary care doctors, the breast exam, the breast specialists, etc. But just be persistent and make sure, even if you can't get in to see your primary doctor, have your primary doctor make a referral. Give them a call. It's something called telehealth, and say to them, Doc, your appointment, people said you're booked up for 3 months, but I felt a lump. Where can I go? How can I bypass that? Because you can. You have a right to do that. And they can then send you to the surgeon. That doesn't necessarily mean you need surgery, but a surgeon would be the one to evaluate and check and see if they need to do a lumpectomy, which is just like it sounds, taking the lump out, or a biopsy, or a mastectomy. So all of that is important, to understand, to understand what's going on with, um, the extent and the degree. Now, again, there's certain different radiological studies, such as a mammogram, a sonogram, an ultrasound, depending upon your breast tissue. Those who are heavy breasted sometimes have to have a special type of breast exam to understand, because you can have what is a abnormal but normal mammogram. In other words, it's really normal, but because of the density of your breast, you may have to have a whole nother type of radiological study. Don't let that frighten you. Many tests that look a little questionable, when they finally do a more detailed, cone down evaluation, is not a problem. But it's fearful, I know. And some people will say, and I've heard so many times, what I don't know won't hurt me. Well, yes, it does and can. What you don't know can actually kill you. So you want to get the information. It's rough, it's sad, it's depressing to even think I may have cancer. But it's even worse for you to not do anything about it, to sit on it, because time is a major factor, can be a factor of the stages of that cancer. So you got to be, whoever it is, male or female, you got to, you know, be strong, and the support system. We were talking just on my show on Saturday about, now with churches being, um, virtual, and some of those support groups are not there anymore. Family units are not in place anymore. So it's difficult for someone to have a cancer diagnosis, breast cancer diagnosis. And with women, unfortunately, I'm gonna keep it real. when you're talking about a woman being told or fear of breast cancer, that could lead to her getting her breast cut off, and what would people think? What would her boyfriend, her boo, or whomever, what would he think? What would he do? Will he leave her? We have groups and support groups, and we say, you know what? If it was the breast, the reason he was there for you, you don't deserve that person.
Absolutely,
Okay,
absolutely,
he doesn't even deserve your time. So it's very important that we begin those conversations, even down to what chemo and radiation will do to your body. Yeah, it's gonna make you a little weak, make you check out for a while in terms of being fatigued, lose your hair. But we got so many beautiful wigs. We have what we call wig gatherings, etc. So you can get past that. But the main thing that you're here on my show on Saturday, we had one of my dear friends, and she doesn't mind me saying her name, Sister Adrian. And Adrian celebrated today 22 years survival of breast cancer. Today, October 11th. That's why today is so special. I know so many, by Adrian, so many tons of my friends and patients, etc., who are survivors. But unfortunately, we have lots of folks who have died from breast cancer, and super unfortunately, many of them is because there was a delay in diagnosis, a delay in surgery, and they just didn't make it. So if you don't hear anything from this podcast tonight, for you to take the steps and love yourself and be
absolutely.
aggressive and navigate for yourself.
Yeah, I think checking yourself out is very important. Everybody, this is Real Talk Chronicles. That's Dr. Marilyn Corder, and this is Real Talk with Dr. Corder. And I am Bill Foster, and this is Real Talk. This is the podcast that keeps it real. I'm just want to read some of the comments to the doctor, or the comments that people have chimed in and said. Please, ladies, gentlemen, whomever you are, please share this. Hey, Naomi, how are you from YouTube? Um, Let everybody know. And she says, hello, Dr. Corder. Let everybody know, share this and let everybody know. You can share the Real Talk from YouTube. You can share the Real Talk from the Facebook, because listen, you're not getting this kind of information anywhere else. I have a question for the doctor, but I just want to read some of the comments because, as you know, I always try to let everybody know. Colin, how are you feeling? It's good to see you here, my brother. Stefania said, that's what happened to one of my friends. When she found out it was stage 4 in October 2018, she passed in January 2020. Doctor, we're going to have to do another podcast on cancer per se, because there's different stages and things like that. And I'll ask you another question in lieu of stages. Michelle Lee, what's going on? Cheryl, I see you. Michelle said you can't stress aggregate potential cancer cells. Elizabeth, I see you. Stefania said, I remember when I was in Liberal Mutual, 25-year-old coworker had colon. I couldn't believe it. Gentlemen, also, I had a colonoscopy not too long, just a couple of weeks ago. You got to do it. Check yourself out. That's transparent. That's a real talk moment. Michelle said, I discovered a lump in my breast in 2018. Fortunately, it was caught early. I had radiation treatment. Tumor was removed, and now I am most aware of my diet and lifestyle. Doc, I want you to stay with that for a second, because like you said earlier, sometimes you got to check out your body and what you eat, and can't have a pork chop 7 days a week and shit like that. You know what I'm saying? Certain things you just can't do. She also says, I tell everyone, the second you notice anything different with your body, seek medical attention immediately. Michelle says, pay attention to your body. Cheryl said, I had an illustration on my wall in my bathroom to show how to do
Yes.
breast exams
Yes.
yourself. I did this because I have girls, so they know what to do. So very important. She said, my daughter discovered lumps in her breast. A sample was sent to pathology, and thank God it was benign. That's an awesome thing. So, Naomi says from YouTube, she said, how do you get through to people who push back with conspiracy theories on the vaccine? So much misinformation out there. Save that. We're gonna swing that into that in about another like 10 minutes, but we're gonna definitely get into that, Naomi. I see you in the building, Luckner. So, Doc, let me ask you a question. Is there a difference in the size of a woman's breast? I mean, cancer is cancer. I'm asking. I'm very naive right now to this.
Right.
you know, so and for the women that think maybe if they're not a D, a C, a K, or whatever, or an A, is cancer? Is it cancer, or is it or the breast size have any difference with it?
So, it's interesting, and that's not an uncommon question. And, when you look at the studies, et cetera, there's several higher risk factors. Certainly, family genetics, in terms of what's in your genetics. That's one thing. First, before I say anything, I thank all of your listeners, but one of the ones that said she had that hanging illustration in her shower.
Cheryl,
That's
yeah.
so important. And you can order those. We used to have tons of those at the office. That just kind of shows you how to do a breast exam. That saves lives. Going back to size of breast. So fatty tissue, no matter where and what, aggravates and can cause more cancer. Now, some people are just heavily pendulous breasts, heavily endowed, as they say, and that's a harder breast to examine. And I say that because when you even doing your self-exam, you putting your head behind your head, your arm behind your head. And what this does, it pulls your breast tissue out and you're doing your exam. But when you're little more, when you're heavier, it's harder to get to all of the surfaces, etc. So sometimes when you're self-exam, you may miss it as well as your doctor. So it's not so much is it more common, it's just harder sometimes. And even when we do the radiological studies, unfortunately, and I'm going to say because I'm up in age, there used to be the old mammograms. Many of us did not want to go because they were painful. We still go, but they now have for moms and grandmas, etc. We have a more comfortable way that they do examine your breast, because we know you're up against that cold machine and they're pressing down and your breasts become pancakes, etc. And it's like more than an ocean. And they tell you take a deep breath and then they say hold it, and meantime your stuff is being, your breasts are being squeezed. That
Right.
information is important. Of course, if they say we got to do it again, get another view, and you're going and going, but it's so important. Is that few minutes of discomfort saves lives. So now they have a better way. So it's improved for those who are sitting back saying, I don't want to do that because that hurt. So heavier breasts sometimes are more difficult to test and evaluate, as well as to find lumps. But genetics is number one. Number two is fatty tissue. And number three, you know, we always would say even dairy products and things, you want to cut back on those things that clog up breast tissues. Now, guess what, ladies? As I've been a pediatrician for the longest time, we also know breastfeeding is a prevention of breast cancer. As a matter of fact, more women that breastfeed, they have seen studies that decreases your chances of breast cancer. And if you think about how that works, there's something called breast ducts, ducts. And when you're pregnant and after the baby, those ducts fill up with milk. Well, if you don't release it naturally, which is breastfeeding and prolactin, etc., that milk sits around and after a while aggravates your breast tissue, so they say. And that's the study. So if you breastfeed for at least 3 to 6 months, that decreases your chances of breast cancer. So that's what I can convince moms who are on the fence if I want to breastfeed or not. I say, you know what? If you breastfeed them or breastfeed that baby girl or boy, you'll be around longer because that decreases your chances of getting breast cancer. So yes, it's so many different, we call it multifactorial, but the key thing is no matter what, let's get the diagnosis. If that's going to be the diagnosis, get it diagnosed early, because as one of your listening audience said, she knew somebody who waited till stage 4, and it may not have been their fault, but if you do some preventive medicine works when you practice prevention. And that again is so key. And it's difficult. We in COVID, as I said, it's a lot of collateral damage, meaning people who have heart conditions, folks who have diabetes can't get in the doctor's office, can't get to the emergency room. So folks are dying of conditions that they would not have due to the clogging up with the medical system with COVID. So it all, it's 360. It is all related. But again, you have to now, if ever there was a time, take your health in your own hands and be persistent.
Listen, I just want to say, of course, I thank you for all the knowledge that you share. Also, we're going to plug your show too, where people can listen to you on Saturdays. I'm going to mention a text that I just got from a breast a person.
Breast
I don't
cancer
know.
survivor. Uh-huh.
Yes, I'll say her name if she tells me. She's listening now, but until she tells me, I can divulge that. But with the one thing she did say to me, she said self-exam is very important. I found my lump 31 years ago, breast cancer conqueror. So that's a beautiful thing. So this is something that can be defeated or stabilized. Let me ask you a question. Um, with stages, is that equivalent to breast cancer? Because I am naive to this,
Mhm.
and I've been blessed to date a lot of women, but you don't get into these conversations until you get a little closer. You understand what I'm saying? I remember my mother, your aunt testing herself and then talking about, oh, I think I found. I'm like, don't give me this. Like this is something else I don't know I can deal with. Like,
Right.
thank God it wasn't that. But what should a woman do the first time she finds out that she has a lump?
Well, share, of course, share that information with her, immediate family. That's important because I'm gonna tell you why. Even though some people are so private, they don't want to. When and if she shares it and sits on it and don't do anything, at least somebody hopefully will care enough about her to bug her and say, "Did you get that check? Did you do this?" So she should let her know. She should tell somebody. Okay.
Mhm.
Um, she should let someone know. And then again, she should act on it. And that's making a phone call, that's getting an appointment, that's talking to whomever. If she doesn't have a doctor, some people's doctors have retired, then she could call, mainly, you could call your local hospital and they can refer you to the right person, the right office to follow up on that, or your insurance company. Call your insurance company. Now, if you don't have insurance, a lot of people don't. There are free mammograms. The services are around. You just have to take the steps and do it and get the services. So, and then step by step by step. We had my dear friend, as was talking about earlier, 22 years today she was diagnosed, and she said that Monday, it was a Monday, she said by Thursday, by Friday, she was in the doctor's office. She was saying, I want the surgery, because she wanted surgery. And that's another thing. When it depends on what stage it is, a lot of people opt for the lumpectomy. In my opinion, sometimes that lumpectomy, you need more than that. And what they do, they take the lump out of whatever that suspicious lump is. But unfortunately, sometimes that lump has spread beyond the margins, and can begin to still be in your breast of that side. And then often you hear folks had to go back because it spread, or they, it's no longer just in that area, it's in the lymph nodes. So, it's a decision that's personal. But I have seen more people now with a lumpectomy say, let's do a mastectomy and get revision. They can get reconstructions. So they don't have to be without a breast. I've seen some great looking breasts from the mastectomy that they do reconstruction, and you got a new set of breasts, but
Yeah,
you're
I do.
alive.
I do know some women, like Helen. She told me I could mention her name. You'll meet her eventually, Doc. She's big sister slash mom's like, but the way we kick it, I just have to give her a big sister. Almighty. Uh, Also, I have some questions for you. Everybody, this is Real Talk Chronicles. Please like it, share it. If you're on YouTube, uh, subscribe to it, share it to your page, share it to your friend's page. I don't care how you share it. Share it from this page, watch party it. This doctor's here every second Monday of the month. Have your questions, line them up, and she'll answer them. Let me have. I'm gonna read some questions and comments, Doc.
Okay.
Stefania said, "Doctor, how long does it take for cancer to reach stage 4? Like a year or so?"
It all depends. It depends, and that's a good question. If, let's say, it just started and it's stage one or 1A, we break it down beyond before it goes to 1 to 2. I've heard folks, and studies have seen a year beyond that, one stage to the next. It all depends on how that reading is. If it's stage one, but been there, it's about to go to stage 2. So what I would tell folks is, I would say even as early as, I've seen it change from one stage to the next stage in less than 6 months. So it depends on how aggressive that particular surgery cancer is, as well as how long it has been at that current stage. And that's so important to get it, identified, because sometimes it may be a year or two, but you don't want to say, oh, I got a whole year before it goes to the serious stage. You want to maximize on the diagnosis and maximize on the immediate urgency of the diagnosis so that you won't have to go through so much. Chemo and radiation is rough. Often you don't have to have both of those. Some people have just had to have the lumpectomy or the surgically removal of the cancer, and then with some chemo and not have radiation. So the sooner, the better the outcome. The sooner the diagnosis, the sooner addressing it, the better the outcome.
Awesome. Next question or comment. Yolanda said, shout out, what's up, Yolanda? How are you, sis? She said, my best friend Shirley just passed away on Thursday. She had stage 4 cancer. Cheryl said, can we talk about preventive, holistic, and natural alternatives, doctor? She also says, my mom was diagnosed with breast cancer last year at 75 years old. She had the destined tissue removed, and she is now free of breast cancer. Absolutely. That was awesome. Yolanda, I'll go back to the other question. Yolanda says she battled cancer 3 times. Her third time, she couldn't fight it this time. She had cervical cancer. I think Shirley got tired of fighting. Her kidneys failed. Then her liver failed and affected her brain. The doctor said that was nothing they could do. I'm sorry to hear that about your friend. But let's get back to we asked Stefania asked about stage 4. Yolanda asked about holistic and natural alternatives. Are there anything that go ahead.
And I'm not a holistic expert, and I'll say that full transparency.
Mm-hmm.
But I will say this: I know that there have been some of my colleagues that will say, vitamin E, excess of, increase that, vitamin A, turmeric, CBD, and even glutathione. Those are different anti-inflammatory, health stabilizing, specifically breast tissue. Again, I also said breastfeed if you have the opportunity to do so.
Right.
Not be obese. But I'm going to say this, and this is going to throw some of you a little back. You need to stop going to the nail salons. I'm going to explain something to you. Okay. I did an hour-long talk at the Annapolis, the capital, on how we have seen an increase in breast cancer in our community. And we stay in the nail salon. And all of that formaldehyde and toluene that's in the nail polish, especially the gels, especially the long-lasting ones, can kill us. Our nails are porous. Did you know that our nails are porous? Meaning that what is on the outside gets absorbed. Guess where our breast starts? In our armpit. Guess what's connected to our arms? Our hands and our nails. So nail polish can cause breast cancer. All of that. And when you go in, and the folks before COVID, folks had masks on because of all the toxins.
Absolutely.
And you're putting it on your body. And I have natural nail polish. There's vegan natural polish. I have a place where I get it here in DC at the Salt Cave, which is a holistic place. So if you want to have bling bling nails, make sure you're using the polish. If you want to take your polish to the lady, then do so. But stop that mess. Stop all that other stuff. I mean, you see all the stuff. And guess what? Not only can they get infected around cellulitis, that's a whole nother story. But your nails, the what we call the lymphatics and the bloodstream goes up to your armpit. And I'm being a little graphic. And that's what next to your breast. Next to your breast.
So we can curse on this show, Doc. Your radio, when you do your radio show, you can't curse it. When you do the other podcasts and other things, you may not be able to curse. But
we get a little live. We get a little live on our show too. So,
I know that, yeah.
So if you think about that, and we've seen more increase in breast cancer in the past 3 decades. When I was in medical school over 40 years ago, we didn't see it. We didn't see it that much. But guess what? At that time, and anybody who's my age, we had something called deodorant, not antiperspirant, deodorant. We had Tussie. We had the natural deodorant. And
Yeah.
guess what we were allowed to do? We were allowed to sweat. Remember, we had the little sweat guards that caught our perspiration
Yeah.
under our arms. It's almost like a pad. We wore kind of
Talk
pads.
it, Doc.
Okay.
Talk
So
it.
we had the little pads under here. But now, pay attention. Now we can't sweat. We got all these antiperspirants and we roaming and gliding, super secret, 24 hours, 48 hours degree. All that's doing is putting aluminum that causes cancer in your armpit. And what do we do first? We shave our armpits. So what we're doing is opening up all the pores. Come on in, cancer. Come on in, cancer. We're shaving it and we're rubbing that on that, and it's going into our breast tissue. And that is what we're talking.
That's a real talk moment. And Doc, you have said something, because all of us, like I manscape, a lot of people, like, we groom ourselves. You would just hit us with some real shit right there, because you said, and I'll let you repeat it, but the bottom line is, I'm smart, but sometimes you caught me. You know what I'm saying? Like, you said even that the deodorant has changed, but like you said, because I'm blessed to be from an era where we was taught even you could put baking soda under your arm.
That's right. Now we have a crystal. Okay, let me start. Now we have even a crystal. Unfortunately, people almost wait till they have breast cancer and then they hear about this crystal. You can go to Costco or whatever and get the crystal. It's a rock that you put up under your arm, and it stops the odor. It stops the perspiration naturally. Let me also add, we didn't see breast cancer 30, 40 years ago like we're seeing it in us. And we'd laugh about our sisters from Nigeria who may not be best friends with deodorant, but they sweating and they smelling. But guess what? They don't have the cancer like we do. So we smelling good and not sweating and not having that sweat film on our clothes, but we're looking good, smelling good in the casket. So we need to understand that we cannot continue to do the nails. I call it not only fake, but all that stuff on our nails is going up our armpits. And we got 13, 14-year-old girls going to the nail salon, etc. That's toxic. That's toxic. That's like embalming. Formaldehyde is embalming fluid for dead bodies. We're putting it, we're putting it on our skin every 2 weeks. And that is toxic. So I'm not a naturopath. I understand the question about holistic, but let's get real in terms of what we need to stop doing in our everyday living.
So funny. I'm gonna have a little humor. So ladies out there, please, if you meet him, if you don't mind, follow with the doctor's orders. If you sweat, find a man that don't mind a little perspiration under your armpit. Right. He just won't hug you under the arms. He won't lift you up, but and then tell him what doctor said. Listen,
that's right.
I ain't trying to get cancer. You're just gonna take a little of this perspiration and love me the best way you can. Everybody, This is Real Talk Chronicles. That's Dr. Marilyn Corder. We are rocking right now. Doctor, I want to read some of the comments and statements in here. Everybody, I will tag the doctor in here. I try to protect her because I know all of you will be sending her friend requests, and then y'all gonna make me mad because I protect her like that. But bottom line is, I want her to come back in her leisure, but she's so busy, and I love her because she's my big cousin, and she
love you too.
And our parents are dancing in heaven, watching us do what we do together, just giving out this information, and it's so great. With that being said, I want to read some of these comments right now. Yolanda said that. Stefania said, "Wow, this is amazing. Who would have thought?" Robert, my man, Robert Ush. How are you, my brother? She says, "I believe in the taking of anti-inflammationists for cancer: berries, turmeric, ginger, and tart cherry." Sharon also, she says, "I was saying this for years." Stefania, she was talking to Stefania. My man Mark said, "God bless all who have been diagnosed and beat cancer." My question is, does cancer hit our communities more than others? Prevention is so key, as you stated. Man can get breast cancer as well. So we are so vulnerable. He said, so we are so vulnerable. Big companies also, but some bad products. Johnson and Johnson. Before I go to the other questions, Mark said, my question is, does Does it cancer hit African American communities more than others, Doc?
So here's what happens. When you talk about total overall cancer rates, we see breast cancer still more in white. However, we see an increase and continue to see an increase in blacks and black women and black men and blacks. And unfortunately, the death rate, the lifespan, the death rate is higher. And so let's say you give 100 African American women or African Americans for diagnosis. Well, they're going to die 3 times as faster than a white person, unfortunately, because of access, because of sometimes we're in denial. We don't want to hear. We don't, no, like I said, no news is good news. So we're seeing an increase in death rate. So people, a lot of the oncologists would say that's because by the time it's diagnosed, it's stage 3 and stage 4. And people drag their feet, etc. But we have to get past that. We have to get past the stigma of breast cancer, of cancer itself. We have to talk about it. We have to talk about. We're talking about colon cancer now. Chadwick Boseman, when he passed, people started talking about how they have to get the colonoscopies because colon cancer is preventable. So is breast cancer. So we need to talk about it and act on it. So yes, when you read the literature, African American women, breast cancer diagnosis, they die sooner because of the aggressiveness and the staging that we get once we've had the diagnosis. I hope I was clearer in
Absolutely.
answer.
Absolutely. Michelle said, Michelle Lee said, I'm so sorry she lost the fight, praying her soul rests with God. We have to be more so aware of our diet, lifestyle, and being aware if any changes with our bodies and seek I'm not sure. You said media attention or medical attention? I'll
Both.
get both. Yeah, exactly. It's sad because I'm in the medical field. Oh, you are? I didn't know that. Field, and I hear many times, oh, the doctor just wants to get rich. No, I thank God for the surgeons and physicians who treated my breast cancer. Stay strong and stay safe, my sister. Against condolences to the loss. I think she was talking about somebody who lost somebody. Stefania said last year I switched all my natural deodorant because I heard lots of horrible things about aluminum.
That's right.
I get okay. Let me find out you got wet armpits, but you still my
Okay.
homie. No, they stop, but that's it's all
But
good.
you got look, that's toxins. Just like we cry, our tears, etc., our urine, we have to let it go. We got to let our armpits breathe. Okay, if
Absolutely.
we clog it up and continue to clog it up and clog it up, those normal cells in the lymphatics as well as in that bloodstream and in the tissue turns into anaplastic. They change and they turn into cancer.
Listen, everybody. I try to throw a little humor in this, but the doctors dropped the jewels right now, and I appreciate all you. And I shouldn't have to ask and beg you to want to share this knowledge to your fellow lady friends of all ethnicities. The bottom line is women have all breasts, you know what I'm saying? So
Right.
listen, we're trying to just make sure women stay around longer. And let me tell you something, we are at these ages now. When we were younger, we didn't really pay attention to them. Now we are the ages. You know what I'm saying, right, Doc? Like we are the ages. So
Yeah.
every year is really a blessing, no matter if you want to say around the sun, however you want to articulate your existence. But the bottom line is, I'm trying to stay here. And I'm trying to stay here a long ass time. I'm trying to stay here longer than my parents. You know what I'm saying? And I
Right.
lost both of my parents in their 70s. Thank God, Aunt, Doris, she lived like to 90, right? Like she
Yes,
yeah,
90.
yeah, yeah.
Yes.
Aunt Doris, she was a bad mamma jamma, though. You know, and she lived longer than all her siblings. So
Yes.
that's her. I mean, and shout
And
out
I
to
have to say, now I also have to say, yes, and she died of lung cancer because of smoking.
right.
It wasn't hereditary cancer, but it was lung cancer. But and I'll say this, other than God, of course, I give him all the credit and the glory. But my mom smoked for almost 25, 30 years. And once I had our first child, I said, Mom, you can't come in my house smelling like smoke. Now
Right,
you
right.
just got to stop. So she stopped smoking at 55. She started smoking at 20. So
Yeah.
it's a good 35 years of smoking. And her body did end up in her 80s having breast cancer. I mean, lung cancer. And it was the type of lung cancer that you get from smoking. I want to say this. The doctors diagnosed her stage 3, just about stage 4 lung cancer, because mommy took forever. She was taking care of my sister who had ALS. She's had
Yeah,
chest pain and discomfort and shortness of breath that she was in denial, not telling us. So by the time she was diagnosed, we thought it was an embolism. In terms of a blood clot, it was a huge inoperable lung mass in her lungs. I had a naturopathic doctor as well as a typical doctor, the oncologist. He said chemo and radiation, and your mom will live for 6 months. I also, in my pocket, I had a naturopathic doctor who said, I have something for your mother. And every night, I want you to give her a dropper full of this drops under her tongue. And my mother lived almost 5 years from the diagnosis. And I will say this, I know it was the Lord, but it was also naturopathic medication, which they had her on CBD, and we had other naturopathic things that helped my mom to the point she was not uncomfortable. She never needed hospital. She'd get in hospitals and she graduate out, go to hospitals, graduate, knew
yeah,
everything up until 2 weeks. Mentally, she was there. So
yeah.
I
Right.
believe, let me tell you, I'm a physician, yes, but I believe that you all better know that naturopathic medicine also works. It will complement the chemo and radiation, etc. But don't poo-poo naturopathic medicine. Thank you.
Absolutely. That's beautiful. Yeah, thank you. That's what's up. I see Yolanda said, oh my God, this doctor has me like, wow, she's so right. Shout out to Anna David. What's up, sis? Very interesting and great information. Stefania said,
Thank
wow,
you.
that's what I use. That crystal. Go ahead, Stefania, you ahead of the game. Yolanda said, great information. Mark Rose said, wow, my mother used to use the crystal. Yolanda
Mm-hmm.
says, I do my own nails. That smell in the nail salon is really strong. Cheryl with the smiles. Mark says, I'm not dating anyone. This got to have a little humor in it. Mark said, I'm not dating anyone who goes to the nail salon. Armpit smelling like trumpet turnip greens. Exactly. That's what I want now. Malika, don't use no damn other deodorant shit. I want you. Michelle was replying to somebody. Mark said, Bill, we lost away years ago. We didn't get all these cancers and diseases back in the days. Your cousin's on point as usual. Thank you. Michelle said, I'm on most days I use powder with cornstarch. You heard of something like that? Okay.
Yes,
Right.
yes. And that cuts the baking soda, cornstarch. What that does, and it's not the talcum powder that gives us what we call talcum powder pneumonia. And you put a little bit in your hand, your palm, and you just tuck it up under your breath, up under your armpit, like so. And that helps the perspiration. It is natural. And again, you want to make sure that you use that, and you're not doing a lot of the shaving. You may be a little more hairy there, but you're alive.
So,
And
so, cuz, let me ask you a question. Is shaving is bad for us?
let me tell you, it is. And I know some people say, "What about waxing?" The hair is there for a reason. I'm not saying look like a gorilla. Okay, I get that,
Yeah, yeah.
but at the same time, you don't need to be shaving and everything's wide open, and put just like somebody shaves their face and then they do the aftershave and it burns. Well, when you shaving up under your arm and you putting that deodorant, etc., you allowing total access of the chemical, aluminum or what have you, into your body each and every day, each and every day, each and every day. And remember the talcum powder that years ago Johnson's was telling folks they could use the baby powder,
Yeah,
etc.
yeah,
Turns
yeah.
out,
Exactly.
was cancerous. Now that was in your underwear, wherever it was, etc. And it wasn't in. We weren't talking. It pushed it up in a Tampax. So can you imagine how we talk about now how cancer spreads? So if it's just there in your crotch of your underwear and cause cancer, can you imagine what's going on up under your arm that you already have shaved and used? So cut down on the shave. If you shaving once a week, then maybe shave once a month. You don't have to shave that much. But
Yeah, I was
meantime,
about to say, Doc, like, damn, like everybody gonna be walking around here like wolves and shit,
but we're gonna be alive. Look,
smelling
we're
like
gonna be
real jackasses outside. You like, no, listen,
we're gonna go back to
I'm
the
healthy,
60s, right?
but ain't nobody want to stand next to me at the
Well,
bus
you
stop.
can
You know
trim.
what I'm saying?
You can trim. But just the thing is, waxing and shaving. I know that's big dollar in that, but I'm
Yeah,
telling
yeah,
you,
because
it's big death.
everybody want to be clean and cute. You know what I'm saying? Yeah, listen,
Okay.
like, yo, all right, I'm bald, but I got cancer. You know what I'm
Right.
saying?
Right.
like, listen, let a little hair grow, and
That's right.
you be all right. You may not have as many friends as you want on Facebook or Instagram, but you be all right and shit. You know
Well,
what
a
I'm
little
saying?
soap, little soap and water, and little not talcum powder, baking powder. That helps, and that
Yeah.
dries. But meantime, you don't have to have all that degree, all that aggravation, because here's the deal. Especially with the young kids, especially my teenagers, you see the armpits discolored, already burnt up, discolored from the strength and the chemical from the deodorant. So I'm having them raise their arm, and I'm looking at the mom. And first of all, there's no hair; it's all shaved, and it's discolored. I said, now imagine you seeing what it's doing on the outside of the skin. Can you imagine what it's doing inside your daughter's body?
Mm.
And they're like, ooh. And I can tell them, I'm not going to say on this, I can tell them what brands they're using. I
Right.
can tell them.
Wow. Wow.
And I said, you got to go
Big. That's
natural.
big. That's big.
And they said, how did you know? Oh, Dr. Quinn, how'd you know? I said, because that's the most toxic ones. And there's 3 toxins. So just get away from the antiperspirant.
Everybody, this is Real Talk Chronicles. That's Dr. Marilyn Corder. Listen, if you have comments and questions, put them in here. If you have topics that you want the doctor to address, please let me know. I'll ask her, because the bottom line is this is her show. She has full transparency to rock whatever she wants to talk about. But right now, she hit some topics. She talked about cancer. So maybe next week we might delve in a little bit more about just cancer. Doc, I just want to give you another 15 minutes because, I know your time is always precious, and I try to be very cognizant of that. Let's talk about COVID. And we have a question that came in. She says, how do we get through to people who push back the conspiracy theories on the vaccine? So much misinformation out there. I know we talked about this so many different times, but go ahead. You're muted. Uh-huh.
Okay. So, yeah, I was on purpose of conversation.
I know.
So,
Tell family, I'm going to give you up in a minute. Tell them family,
okay,
hold back
I
for a
know,
minute.
I
Yeah.
know. But, again, the misinformation is killing us. It's setting us back. We can still get, now let me just say, understandably, in the beginning when folks were told if you get vaccinated you're not going to get COVID, that was not true. You can still get a breakthrough. People who are vaccinated can still get COVID. All right, but we're talking about it will not be as aggressive because you have your defense from the vaccine, as well as you are not going to be on a vent. That's facts. When we see the folks who come don't survive COVID unless they're super elderly with comorbidities. The people who have been vaccinated can survive and are surviving. Only 2% see fatality, but 90-some% in high numbers of those that are hospitalized are those that are not vaccinated. So we're talking about what we now see is the pandemic, the non-vaccinated pandemic, which folks on the front line see as this is not necessary. This did not have to happen. They're constantly being exposed to folks with COVID that didn't have to happen because they didn't have to be hospitalized. So that's my, soapbox. What is happening now? We do have misinformation, and that's going to be there, conspiracy, etc. We know it's not a chip. We know that the vaccine does help protect, just like measles vaccine helps, just like uh, tetanus, pertussis, etc. There's nothing that's a cure-all, but we have to get our defenses up. Over 700,000 people died. I have a dear friend of mine who was funeralized on Friday, a very big physician, big time practice in Norfolk, Virginia. And he died. He had gone to a wedding, and it was a super spreader. So be careful with these events. It was a super spreader, and he and 19 other people caught COVID. He died, and his brother died. His brother was from New York, so he traveled to New York, not realizing he was COVID positive. 3 or 4 days later, up to 5 days, got very sick, went to the hospital, never came home, died. So this is happening.
So Doc, what time are you coming on? Doc, so please talk about that super spreader, because people out here feeling like if 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 I take the vaccine and I still catch COVID, like, well, why I'm taking the vaccine? You broke down the story so eloquent last month about the pigs in the house. Can you break that down for the people?
Well, I'm a pediatrician, so I'm gonna keep it real.
Yeah,
So
absolutely.
the story of the three pigs building their house. One built a house of straw. One built. Well, I'm trying to remember.
You said the straw. Whatever it was, the straw something and the brick.
But the stone, right? The brick. So the defense that you have from getting your vaccination is real. Now that doesn't mean that the wolf is not going to come to your door knocking. Okay, the wolf being the coronavirus, COVID, Delta, you name it. It's always going to be something. It's like the variants are now like hurricane names, but it's out there and it's here. And this is wintertime. So we now have a triple threat. We have the pandemic, we have the flu, we have inside and activities. So that is just going to hit us even harder. Get vaccinated because the house of bricks is going to stand. Those house of straw and hay and weak stuff, even plywood or whatever, it's gonna fall and it gets more affected. And that delta will run through that like a steam blow. I mean, it will just go through it, and it would be nothing left but the top of the roof, if that, meaning death. So your defense that builds up due to the mRNA, I didn't say DNA, the messenger RNA begins, we're in the football season, begins that frontline defense. Is your body allows to practice because they know it's coming. And like I said about 6 months ago, a whole lot of us are going to be exposed to coronavirus 19 lambda variant, what have you. But you want to already be prepared. You want to have already had that fire drill before the fire comes. And that's where we are.
Now, of course, let me just shout out my significant other.
Hey, Malika.
Hey, it's so funny. I was telling
good
her
to see you
about all the bad news that we received today, but
I apologize. I wanted to be here right here at 7, but literally a half an hour. We just got hit with a few stories, and Bill, you shared.
Yeah, I shared the news.
I had to update my mom on what's going on. So
right, absolutely,
a lot of prayer right now.
So,
amen, please.
So
yes.
with that being said, like I said, anybody you have questions for the doctor, please put them in real quick. I'm not going to keep her no more than maybe another 10 minutes so she can get out of here and spend time with our family that's in town and out of town. And all these moments are so precious. And please cherish every moment, everybody. Life is so short. It really is.
Yes, it is. Yes.
The crimes and things that are happening out here, watch your back all the time. And, Malika, just for edification, Malika's going to start doing segments again on entrepreneurship. And Doc, maybe you might have to be one of her entrepreneurs because you did have, you and Fred.
I have to show her something.
Yes, please. You and Fred are started your own practices because sometimes we may have to do a segment on that with her so you can tell people how it is to have that faith and belief that you can go out here and do your own practices. So I just want to put that plug out there. With that being said, and then she can interview Fred and Adrian along the lines because entrepreneurship runs in our family, and that's a beautiful thing.
Really
so go ahead. Yes.
Look what came today.
And look what came today. And also too, Malika has her own another line that she's starting.
Oh wait, it's a glare. I'm not sure if you can see the logo, but it says "Love Thyself." Love thyself.
Love it.
And I have pink for Breast Cancer Awareness Month.
Yeah.
For every day.
Yeah, absolutely.
Send one of these to you.
Yes,
it's something, a phrase that's been in my head, and I use it as a hashtag often. And it's been a reminder for myself, just slow down a little bit and take better care of yourself.
Absolutely. Love thyself. Exactly.
Yeah.
It's trademarked, everybody, so don't even try to get this shit.
It is.
We don't worry about this business.
Sending one to you, Marilyn.
I love it. Thank you so much. That's a daily reminder for sure. We need it.
Absolutely. We all need it.
Yeah, we definitely need it. I want to go back. Colin, I know you said something that you had recently. Let me scroll back. Colin said, I had skin cancer 3 times, caught it myself, and I had it treated with 12 treatments of radiation all 3 times. Just had kidney transplant 13 days ago. Colin, you are my man.
Yes.
Wow.
Yeah. Any advice that he should do, Marilyn, while he's I guess he had the kidney transplant.
Well, one of the things I always tell folks, be aware of even the over-the-counter things that aggravate your kidneys. And I'm sure your doctor, first of all, thank you for sharing that. I was, wow, it took me back in the 80s. I was on the first kidney transplant team here in Washington, D.C., Dr. Clive Callender. And I remember all of what we had to go through in terms of getting somebody prepared to receive a kidney, as well as getting a donor, getting a match, rushing the kidney here, doing the procedure, and then being on those medications that what we call prevents rejection. Because that kidney that you have is a blessing. Sometimes your body will see it as different and may reject it. So we always have you on medications for that. Be mindful of the medicines that even are over the counter. Don't take if it says, and you have to read the fine line, can cause kidney damage, can cause renal damage. I always tell folks this ibuprofen, Motrin, etc. Please be aware that's not a good medication. I know everyone has it in their pocket for whatever headaches, cramps, what have you, but it has kidney damaging effects. And people who don't even know they're having kidney problems until they start swelling up. So those that have had a transplant, you want to make sure that kidney lives on and on and on as it allows you to live and enjoy life. So congratulations. Because also you've had a transplant, we want to make sure you have major protection from all of what's going around, from flu to COVID. They will give you several vaccinations, of course, even the pneumococcal vaccination, and then just stay away from sick people. I mean, we all need to do that anyway. And if they need to have their mask on, but the holidays are coming, and we want to be around our loved ones, etc. But those gatherings can be super spreaders, and you want to make sure that you do each and every day, as you eat well, as you get your rest, as you check up with your doctors, and monitor, your renal functions in terms of your output. I know you're tired, and I'm glad you're no longer on dialysis. But right now, as you are beginning to, like I said, your urine output, etc., just note blood pressure issues. Note that those things you want to make sure that you don't have a problem with. So I applaud you and commend you for being a survivor. You had skin cancer. Some people don't know people of color. I don't know what color you are, but people of color get skin cancer too. So everybody can have skin cancer, as well as we definitely know people of color are often on dialysis and have, if they're fortunate and blessed, to get a transplant. So on that note, I'm just going to say, keep on keeping up and love thyself, because
absolutely.
Unless you do, you won't have the love you need.
Yo, listen, I mean, Doc, before we get out of here, that's my glasses. Watch yourself. Oh, all right. He said thank you. He said, Doc, thank you. Mark said, yes, Doc, some protein powders as well. Doc,
yes.
Before we get out of here, like, it seems like there's variants are coming out like dances, like what
like hurricanes, right?
Yeah. What's the next? What are we dealing with right now? I know exactly. I'm gonna join you. Let's go one more time together. This shit is killing me.
Oh my God! It's like all of the alphabets. I just, I'm just. All I can say is just stand your ground, and like I said, build your house of bricks and stand your ground and do everything you know to do. And please prevent going to the super spreaders. Please. I know they're weddings. I know you want to be around, but we want you to be around to be around. All right. So not go virtual as much as you can. Please.
Yes. Cheryl said last year I did not have any holiday gatherings because of COVID. I did to-go plates, packed up and hung it on the door. I would be doing the same thing this year. I get it. Doc, we talked about cancer. In the upcoming months, I also told the doc that you're going to be doing your own show, so maybe you'll have her on entrepreneurship. But also, there's so much to talk about. Mental illness is a big thing, Doc.
Ooh, yes.
So we have shows. We have mental illness. We would talk about cancer. You let me know what you say. People out there, please if you have a show that you or topic, excuse me, if you have a topic that you want the doctor to converse about, let us know. I'll ask her. I mean, if she's not, well, listen, she got 40 years in the medical business, so she know. And we come from a Foster line. We smart, crazy at the same time. So we
keep it real. We keep it real.
Exactly. We can tell you about some real psychological shit. You know, you got to do some humor in this, right? But please let her know. Let me know. And I mean, if she wants to take it to somebody that is much more in that field, because she's an expert. But if she wants to, then anytime, Doc, you just want to bring somebody and any of your colleagues on, that this is your show. Like I always say, this is your show. This only thing that we wanted to give this to Breast Cancer Awareness Month, and we wanted to kind of touch on that topic because there are so many people out here. The doctor was talking about touch
deodorant. I heard
that was crazy. You know what I'm saying? So I'm gonna let you grow a little hair under your arms. Get a little foo-foo-ish. You know what I'm saying?
Right?
I'll just hug you from the outside and hold you tight. You know what I mean? So, Doc, before we let you go,
I'll tell you, mental health is so important.
Yes.
My expert on my show on Saturday, a psychiatrist, and we were talking about breast cancer. And one thing he said, we said obesity, but he also said stress can contribute to breast cancer. So I'm like, oh, well, my God, we all need now a life coach, because who isn't stressed? The shorter answer is who's not stressed? Maybe a newborn, but beyond that.
And what's so funny, as you said, there's so many things that stress us. I mean, thank God some of us are blessed with stress of buying something or I'm late for something, but like you said, thank God we, that medical stress is crazy.
Yeah.
And that mental stress is something else. And you and I could definitely discuss that. And we've kind of touched about that before, where we, that's paramount in what's happening in law enforcement, along with mental illnesses, because they're not taught how to deal with people that have psychological issues right now, or going through personal things. And this is a whole nother topic and conversation that we can have, and we will have.
And yesterday was World Mental Health Day.
Yes, and yesterday was World Mental Health Day. So we need to be cognizant and care and take certain approaches. And Miles, say hi.
We have a good stress reliever in the house.
She does.
His name is Miles.
And you know what? And you're right. Pets have been more adopted because it does release stress. So we have to love our four-legged babies.
Absolutely.
Anyway, Doc, before you get out of here, give us some positive affirmation so I can let you get back to our family. And
right.
and like I said, we could talk about in the future, you and I'll sidebar and talk about things, because everybody, please understand, the doctor and I, we share information, as a cousin, as a friend, and as a doctor. I send her all everything that I get. I pump it to her.
Yes, you do.
So, I mean, I know sometimes I can be overbearing with it, but what's so funny? Knowledge is something that you can't, you can always get, but you can't say when you want it. I mean, you can say when you want it, but I mean, I try to give it because I know you have a show and you talk about so much and so many different topics, just like Real Talk. And
right.
and it's almost like, like here, you can talk about this, you can talk about that, you can talk about that. So everybody, please give the doctor some hearts, some love if you like what she just gave you. And doctor, give us some positive affirmation on what you want to say.
Well, let me just tell all of your listening audience, I'm every Saturday. You can find me on Radio 1, WOL, 1450 AM. I have my own talk show for the past 20 years with Kathy Hughes, and it's Dr. Corder with Village Talk. And I want to just say, and it's funny because cousin Bill, my little cousin, he mentioned, knowledge is power, and we want to empower the village. And that information that you heard tonight, I just want to make sure that you take it from your lips to others' ears to make sure you inform them. Information, that's what we need. That communication. We can no longer have our heads in the sand. We need to now pull our heads up and shout from the mountaintop to save lives. So again, I want to thank you, Cuz, for doing this fantastic Real Talk, because we have to keep it real. And we
Thank
can no longer be embarrassed about what's going on with our health. That information that you have about your body, again, will not only save you if you act on it, but also save others around you. On that note, this is Dr. Marilyn Corder dropping the mic.
Love it.
Love it. Everybody, please share it on YouTube. Go to YouTube and share it. Subscribe to it. Listen, you're not getting this conversation. I guarantee most of you are not getting this conversation with your own primary doctors. So listen, act like you know. Real talk. We out of here, right? Say bye, Miles. Good night, everybody.
Bye-bye. Take care. Stay safe.
Stay safe. Yeah, man. Hold on, Doc. We about to. Oh, she's out of here. Good night. Okay.